good afternoon. I'm Dr. Annette Mercatante from the St. Clair County Health Department.
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management.
And welcome to Facebook Live. I think you all know what we're going to talk about today, so let's get right to it. We'll go through the data real quick and then we'll talk a little bit about the school situation. So today's update shows a cumulative number of cases. We're getting close to 1,976. No further deaths for some time now, so that's the good news. And we're at an average of about 3 new cases per day, which is pretty stable. Our percent positivity rate remains under 2%. And so overall, I would continue to say that St. Clair County is doing well when it comes to community-wide transmission. We are in a moderate to moderate high risk. We kind of shift back and forth there. And that information is available not only on our website, but on the My Safe Start website that the state has, so you can see it right down at the county level. As far as our graph goes, we do have that up and down seesawing effect. You can see at the end of that graph we're having a little bit of an uptick. It is too soon to say whether we're on a shift upwards or downwards. But we would expect a little bit of uptick now that we have schools back in session. We're going to see a little bit more transmission. We're going to talk about that a little bit more. It's not necessarily a deal breaker. And our testing graph that shows some up and down again in our testing capacity, but overall we're maintaining our testing capacity and we're remaining stable when it comes to our percent positivity, which I would say is a trend we see throughout the state, that we're not seeing a real high level of positivity. I would say the exception, I was looking through our counties, and Macomb County is still at a 6% positivity rate, which again is right below us. The World Health Organization puts about a 5% margin there. If you're going above that, you got to start worrying about wider transmission. So we're still, like I said, well below 2. And finally, our day-to-day counts on our website. Go to our dashboard. You can see our daily hospitalization rates. Today, our cases are at 3. We're doing well with recovery, and as I mentioned, we're doing very well with fatalities, deaths, and severe illness that's ending up in the hospital. So let's get right to it.
I would also like to add, this is day 185. So we're just past the 6-month mark in our response.
So COVID fatigue, and we'll talk a little bit about it at the end. But as you know, so the big issue is back to school. Some of our schools, like KPIC, have been back to school now for 3 weeks, and not a lot of problems. No cases that I can report out to you. And yet recently, as you know, we had some cases crop up at Port Huron Area School District. And all the questions that have come in, I think I can kind of summarize it. Let's just start at the beginning. Over the weekend, we had a positive case come in. It was a student, but also her family was involved. That workup, quite honestly, few exposures as a result of her being in school. However, the parent issue started to become obviously an issue. As we have it, this is a small community, and many family members all work within a similar type of school or a setting. So we had parents who worked in the school district, in the same school district as the kids were going to school. The following day, we had some more cases crop up. And again, it was a family related to positive students as well as positive parents. Those parents also were staff members in Port Huron Area School District in different parts of the school district, different buildings outside of the high school. And so then our contact investigation proceeded, as we always do. The protocols are pretty straightforward. We first get a positive case. We confirm that positive case. It has to be either a positive antigen or a positive PCR test. We need to see those results before we start our investigation. And then we contact the individual, we start talking through the situation and finding out what the problems are. So by Monday afternoon, it was pretty clear that there was a variety of things happening in the school district, and the investigation was not yet complete. As you know, there was an athletic team involved, and there was just a lot to do. In that conversation with the school district, we had a couple obvious situations. One was, and I'll say right off the bat, we were very pleased with the situation in the schools related to the students. The protocols that the school district has set up really protected to a great extent any exposures to other students. There was really just a handful of exposures student-wide as a result of that. So we were very pleased with that, and kudos to the school for that. On the other hand, we had other situations like teachers and other staff members that were clearly going to create a problem for the school. So the decision that the school makes, the health department supports by advice, by trying to offer our expert opinion, and by our investigative capacity when we investigate the cases and help understand what the situation is. The school's decision was to take that 14-day break, not because necessarily, in fact, not because there was transmission within the schools. In fact, we don't believe there was transmission within the schools. We believe there were two separate situations of positivity with people within the same school district and same school building. But there were operational concerns that the school had as far as maintaining a school without staffing. There were operational concerns. There were concerns they had about confidence the community had, and the fact that our investigation wasn't yet complete. Our recommendation was at least a temporary shift to virtual so we could catch up with our contact investigation. It did not require the full 14 days, but in the utmost caution and with the school's decision or desire to do so, we supported that decision. We always want them to do the least that we would advise, but certainly doing a little bit more is safer, and we can't really get involved a lot with school operational issues. So that resulted in the school's decision to do the 14 days with our support. And I will say again that we did support that decision. There is no tremendous amount of disease or transmission of this virus in our schools, and we're comfortable with a shorter time of virtual learning, but that is completely up to the schools, as is all of these final decisions about what to do with learning and sports, etc. This is, you want to talk about that a little bit so you can talk to them about the law and what the law states?
Yeah, so a little bit, we were talking about this beforehand. The Public Act 0149, in consultation with a local health department, is required to make those decisions. And it's based on local data, local health data, and other information that they receive from the health department, potentially from emergency management, and from other opportunities where they can receive key information. So, health code law, and it is the requirement of the school district to make those decisions. It is not the health department pushing decisions on the school district. So we just want to make that very clear.
Right, and I would say that if the school made a decision that we were opposed to, we would make that clear as well. We're always going to err on the side of caution to try and avoid, because remember, what we want is schools to remain able to learning, and in order to do that, we can't have this virus start spiraling out of control. So the control side of this is to everyone's advantage, but the point is that people can continue to work and continue to go to school in person. So that is the intention. That was what happened this week. The sports decision, likewise, we did have exposures in one sports team, our volleyball team. That took us a while to figure out. It's not always very clear, and again, we had to err on the side of caution. Looking at the policies and protocols, these are not always straightforward, but we came to that conclusion with the volleyball situation, but we didn't necessarily need any changes with the other close contact sports. That's the football, and the band, and what was the other close contact sport? Soccer. The school decided that, again with our support, with our full support, because again at that time there was a lot that we didn't know. We didn't know what the extent of those exposures was going to look like, and they felt that a pause, a 1-week pause, would be safer than allowing these games to continue and then in hindsight having to quarantine a lot of other people. Remember that we have a positive case. There's no question positive cases cannot continue in a school setting or any congregate work setting, etc. And then based on where that person's been and what they've done, we identify the circle of exposure. We call those people who are going to be quarantined. And those quarantined individuals can be a few or can end up being a lot. And that's where our investigation can sometimes take a little while to figure out. So this is where the decisions were made. We apologize. I'll be the first to say if communication wasn't the best, we're going to learn from this, and we're going to learn how to communicate this information better. This isn't the first time this is going to happen or the last time, and we're going to just kind of keep moving forward. So take a break. It's all okay. Everyone's okay. And in-person learning is clearly going to be able to be continued as far as the public health perspective is concerned.
And I'd like to add a couple things. Number one, student, staff, and community safety was always the number one requirement in all the decisions that were made in the last 8 or 9 days. So that's a key to this. And number two, it's making the decisions to do the 7-day, to do some of the other things like the 14-day pause on in-person learning at those 3 schools. Those decisions were very difficult decisions, I know, for the school district, but they were making them with the best information they had at the time. And as information started cleaning up, there's always opportunities to adjust. And like Doc just said, we're going to learn from a lot of these things, and we're going to make some processes better. But obviously, this was the first time that we went through this because it's a novel virus, and we're learning as we go. And everybody did as good a job as possible making the safest decisions for the students, staff, and community, and we're going to continue to move forward with that.
So another thing that came up a lot of miscommunication or misunderstanding is since those 3 buildings went from in-person learning to virtual learning. By the way, we don't want to say that the schools closed.
Right.
Education continued, but those decisions for those buildings, the entire building and everyone involved were not exposed. That wasn't the purpose of that.
Right.
Those who were exposed were contacted. They know who they are. They've been notified. They know what to do. Everybody else is not an exposure. And that goes to the other question we often have. So if one person has been identified as an exposure and they've been asked to quarantine, those people that they've had exposure to are not also quarantined. It doesn't work like a slippery slope all the way, like a domino effect, unless somebody, again, on their own gets sick and then we start again. But an exposure to an exposure is not a real quarantine. And so you just got to listen to us. We'll try and guide you. If you're concerned, ask those questions. But in general, I would have to say everyone involved in this particular Port Huron area school district event has been notified. You know who you are. We've talked to you about the fact that you are in quarantine. If you haven't heard from us, you're not expected to quarantine. You can carry on, go to work, do your thing, and we'll go from there, okay? If you do find yourself getting ill, I'll say this again, get tested. It's the only way we can be sure we're doing the right things. And we aren't asking people to run out and get tested just because they think they've had an exposure. Again, getting tested for no reason is really not that helpful. What is helpful is if you start feeling ill, is to get that test so that we know whether it's just your allergies or whether it's in fact COVID. Okay.
Right.
All right, first question.
Yes.
Of the recent positive cases, what percentage are asymptomatic and how many are becoming gravely ill?
Okay, so I just mentioned that we're not seeing a lot of gravely ill. Nationally, the statistics I continue to see is out of every 100 people, anywhere from 40 to 50% might be asymptomatic. And that, again, out of 100 people, 20% will end up being ill enough to require some kind of medical treatment, and out of that, 5% may end up so severely ill they're going to require oxygen or ICU treatment. So very few people. Now in our case, as well, asymptomatic testing, and what do we have?
25% of our active cases are asymptomatic.
So 25% of our active cases are asymptomatic. And again, that can vary. Why is ours different? Not because we have a different kind of population. We're not more or less susceptible to the virus. It's just who ends up getting tested. okay? But still, what that tells you is pretty obvious. A lot of people don't have symptoms and don't have significant symptoms, which means we have to be, this what makes it so hard. We have to be extra careful if we don't want this to keep spreading, okay?
All right, next question. What are you seeing with long-term symptoms? Headaches, fatigue, chest pain, hair loss?
That is not formally, so the question is, what about the, what do they call it, the long haulers? The long COVID. So there is definitely case evaluations coming out now, case studies of people who have recovered from COVID but continue to feel poorly for long periods of time. Obviously, it's only been around for a few months, 6 months, so we're not talking years, but people who are definitely should have been feeling better by the end of their syndrome and they're still feeling sick. We don't, it's real. I can tell you we believe it's real. But we really don't understand much about it. We do know that this virus is a little unique than other viruses. It's not your influenza type virus. It seems to create a unique pattern of inflammation in our immune system, and it particularly seems to inflame the linings of blood vessels, which is where we get into the problems with vascular problems with COVID, where we have issues. At the beginning, I think we had a lot more deaths because people were stroking and having heart attacks and blood clots. Our healthcare providers know now to immediately address that issue of coagulability. So we're learning. But this is a unique virus in that respect, and perhaps those inflammatory components are creating a system where people continue to feel bad. What's interesting about the long haulers is they're not necessarily your frail, comorbid people, the people who you'd expect are already really sick. These are people who are relatively healthy at the time of their infection, and you'd expect them to recover, and they just don't. But we have a lot more to learn about that, and I can tell you that formally that is not being tracked here either, and I'm sure at the state level we're going to start seeing some data collection at that level, but there is no formal collection of the number of people in our state or in our local community who have this condition.
All right, next question. It's another school question.
Okay.
Are schools going to stay open if there are positive COVID cases? And what is procedure for this?
Okay, let's talk about what our general scope of protocol is for a positive case in the school. I mentioned to you before we do have some general guidelines. It starts with what our community-based transmission is. And we use the My Safe Start guidelines, we use our own internal data, and we identify whether we consider ourselves anywhere from a low-risk community up to where the highest risk community. And in those gradations, we base that on case counts and percent positivity, et cetera. But right now, we are sitting in a moderate risk category. And then as we go across the schools, we have no cases in the school, in which case we continue to function the way our Phase 4 guidelines address. So there's requirements for Phase 4 with masking, etc., but we continue that in-person learning in that degree. If we have cases, the next column over, again, it depends on whether you're a high risk or, a moderate risk, or if you're in a very high risk, it changes. But right now, for a moderate risk community like ours, a case in the school or cases in the school, as long as they're not epidemiologically linked where we feel that they're catching it from each other, we definitely can continue in-person learning if all other factors are there. And we don't just continue as usual. What we do need to consider is, how can we improve on the risk reduction strategies? How can we improve on the social distancing piece? I think we've all learned a lot this week, and I think people are going to do a much better job. How can we improve on consistency with mask wearing, consistency of not going to school when you're ill? Those are risk reduction strategies we work. And then we also have the option in that category of taking breaks, anywhere from 2 to 5 days, or even sometimes more, depending on the situation, to catch up with our contact tracing and our investigations, do the cleaning, make sure that we have everything in order to restart. So that's what we do with a case or cases in the school. If we have evidence of transmission within the school, so we start seeing cases, and usually we're talking about 3 or more here, that we start thinking related to each other. So these cases didn't develop because there's people at home sick, or they were at a specific event where we know there were other cases. Their only realistic way of getting infected was through each other, and like say they were in the same classroom and they get sick within 14 days of each other, so they're related. That's when we start talking about longer breaks. And that still doesn't mean you discontinue in-person learning, but you have to again look at the situation in the community. So as we go further up into a higher risk community, that's when we start thinking about switching back over to virtual learning. So it varies a lot. That grid is available. We can talk about it over and over again, but it's there as a guideline, not as an automatic decision-making tool. And I just want to use it. It was developed for local public health departments to guide us on our decision making, or our guidance to the schools, where the schools are making the decisions. And it allows for continuing education in person, even though there are cases in the school. It does allow for that.
All right, next question. How many are in quarantine because of the Port Huron situation?
The question is, how many are in quarantine? I don't know. I'll be perfectly honest with you. I lose count. We have situations all over the county where we are looking at cases and quarantines. I really couldn't tell you. It is less than 100 and more than a few. No, it's. I'm a little sarcastic, but certainly when we started including the volleyball team, that added a lot of numbers there. But I'll say again that the number of people quarantined was surprisingly and gratefully relatively small.
Yes, less.
Way less than it could have been. So the schools are doing a good job with the protocols they have in place, protecting students. So even if you're in a school building or in a classroom even the ones within the classroom with a positive case, many of them were deemed not exposed. So the system can work, it does work, and we're anxious and eager to get it started again.
And I just like to remind everybody again, quarantining is just a safe way to provide some space to allow everybody to, one, make sure that we don't spread the disease any farther with that group of people, and two, give a little time to see where we are with that group of people. So I know that it gives a negative connotation, but we really have to fight that and understand that it's just a tool to get through this situation.
And let's do our language again. Isolation means you're sick or you've been tested positive. Right. You have COVID infection. You are isolated. The isolation period is 10 days from the onset of your symptoms, or 10 days from your positive test. Minimum 10 days, but you also have to be feeling better and your fever has to be gone. So those are the guidelines for isolation. Quarantine is when you separate yourself even though you're well. So you were exposed, we don't know whether you're going to get an infection or not, and we know the incubation period for COVID is 14 days. So if you've made it 14 days and haven't gotten sick, you're home free. So the quarantine period is actually a little longer. It can keep getting extended because it's 14 days from your last exposure. So say you're living with somebody who has COVID. They come home, they're isolated for 10 days. You continue to live with them during that 10 days. Your quarantine period starts on the last day of their isolation period. And so it can really get tricky. That's why our staff is here to help you and walk people through it. But isolation and quarantine are two different things. Related, but two different things.
All right, next question. Is asymptomatic spread happening, or is it more from symptomatic people?
Okay, the question is, does asymptomatic infections allow spread of the infection? And I think we can say, yes, it does. There's a lot of discussion. Is it more infectious or less infectious? But it's very clear you can spread the infection even though you don't have symptoms. Very clear. So let's just take that off the table. Asymptomatic transmission of the disease is real, which is why we still isolate people who have positive tests and feel absolutely normal. There's also some discussion, do children spread the infection more or less than the adults? Often we just don't have the answers to that, but it is very clear that children can and do spread the infection as well.
Right.
So based on your age or your symptoms, you just can't be sure that you're not spreading that virus.
Right.
Okay.
Next question. It's a little bit longer one, but it's a school question.
Okay.
Is it true that if someone has tested positive, example, a teacher and you close a school / class, you still need to quarantine for another 14 days after their 14 days are up for a total of 28 days? Does that make sense?
No. Okay. So the question is like how long of a period? When we have school transmission, typically to be confident that ongoing transmission has been broken in a community or in a population of some kind, whether it be a classroom, a school building, or a district, we like to see 2 incubation periods go by without a case, and that is 28 days. But that's not the same as what we apply to an individual. Okay? To an individual, if you've made it 14 days past your exposure date, we consider you free to go, clear to go. And this is not 100% guaranteed. There's no question. People are going to sneak through the system. Say you're in quarantine for 14 days and your infection starts coming up and the virus starts replicating in your body on day 12, but you're asymptomatic. Okay? How would you know? You wouldn't. Okay, there are situations here where even if you do everything right, we're going to still see transmission of the virus. The goal is not to stop the virus. The goal is to keep it slow, the spread slow, so that all of us and you and our students can go to school and we can continue to live a somewhat normal life. That's the goal. We've said that before. So nothing is perfect. We just got to make our decisions and move forward.
All right, will you take the first question on your sheet?
Absolutely. So first question I have that came in offline was, do football players have to wear masks the whole time they're playing? And the short answer is yes. Part of the deal to restart sports in high school and middle school, under Executive Order 180, was that athletes that are participating in contact sports where we couldn't create 6 feet of distance, they're required at all times, other than swimming, to wear masks. And that means while playing the game, while practicing, while getting ready to play the game or practice. So yes. So that's football, soccer, and volleyball. Other sports like cross country, tennis, they're not necessarily required as long as they can keep 6 feet of distance from other people, or the contact is very short, right? So in cross country, you might be next to somebody else, but that contact is very short because they're coming and going. So, and the same thing in tennis.
Yeah, you can see where there's a lot of gray area here, right? So,
yep.
Fleeting contact is fleeting contact is the term they use. So,
all right, this is one of the questions we got
okay.
for the live. If so many people are asymptomatic, why are businesses still requiring a temperature check at the door? So the question is, if you have so many asymptomatic people, why are you doing temperature checks? And actually that's come up. The CDC and the NIH have actually said, look, temperature checks are not the most reliable. It's something, okay? But the overall question of how are you feeling is probably a more reliable screen. There was some executive orders that came out that required healthcare facilities and certain high-risk buildings and businesses to use temperature checks. Those executive orders, as far as I know, are still in place.
They are.
So we have to do these things. It helps, but you're right. A temperature check is not going to be the most reliable. What is the level of febrile fever in our symptom list?
60% of COVID patients in St. Clair County have a fever at some point.
Okay, there you go. So according to our data, only 60% of the people who we've identified as being COVID positive have reported a fever at some point during their illness. That means 40%. That's a lot of people who don't report fever. So you can see that, again, these criteria are built to help, but they're not in any way absolute black and white conditions. So if you don't have a fever and you still feel kind of crummy, I would urge you to still consider that as a serious concern.
It's part of why they call it practicing medicine, right?
Practicing medicine.
Next
Okay.
question on your sheet, Justin?
Yes, ma'am. So the second question I received earlier was, where can I go to file a COVID-19 complaint if a business is not following masking or social distancing protocols? And we've talked about this a lot. You can contact go on michigan.gov/coronavirus, and there's a link to the MyOSHA site, and you can make a complaint there. You can also call the COVID-19 hotline at 810-966-4163, or feel free to email us at covid19@stclaircounty.org. And so it's very important that everybody do their part to slow this down as much as possible.
Especially now.
Especially now that there's much more interaction in the community. We're pretty. How many active cases do we have today?
Today we have 44.
44.
So we have 44 active cases in the community. That's a pretty good number, and we're looking to stay there or
Now,
get lower.
Remember, that's 44 known.
That we know.
For every
Yep.
case, you got to assume there's probably 10 more,
Right.
is what the data would suggest. So 400 or 500 active cases, perhaps, in the community. But still, that's not a lot,
That's
but
right.
it's enough to really cause a problem if one of those cases is at a football game and they're not wearing masks and they're all bunched up together. It could be pretty clear that at the end of that game, there could be a lot of people who've been exposed.
And we've said this a lot too. Remember, the virus is the only enemy here between the health department staff, my staff, and everybody who's trying to help fight this thing. We are all in this together, just trying to get through it the best we can and make sure everybody in the community stays as safe as possible.
And I just want to say too, it's not your fault if you get COVID.
Right.
There shouldn't be any stigma to this. There shouldn't be any bad feelings. If you're quarantined, stay quarantined, because you're going to feel kind of bad if you break your quarantine and then you end up getting sick and then other people get sick around you. But you know what? It happens. It happens to everybody, and I don't want people to take this personally. Just do your best and realize that this virus really isn't judging. We're not judging anybody if they get infected. This is just something that's. In fact, I would venture to say, before this all over, almost all of us are going to have, in one way or the other, either been exposed or have been infected with this virus. That's kind of what herd immunity is all about. So don't beat yourself up. Don't beat up the people near you. I'm not saying physically, but I mean just emotionally. We're all in this together.
That's right.
And there's no harm in realizing, oh, I kind of made a mistake. I better pull back a little bit and do a better job moving forward. Okay.
Another question for you, Doc. I'll be having heart surgery, and 3 family members from a different city will be coming to live with me for a week or 2 during my recuperation.
Yeah.
What precautions should I take?
So number one, I would talk to your physician about this. Obviously, having heart surgery, having cardiovascular disease is one of those risk factors that would put you at greater risk. Ideally, you don't want to expose yourself during your recovery to individuals who may be harboring the infection. This might be a situation where it would be reasonable to have those individuals tested before they come into your home. We generally have to weigh all these pros and cons. It's not a guarantee, but it would give you a certain extra level. The other thing is to make sure that maybe they've quarantined for 14 days before they come into your home. So again, that little window of support and safety there that you can build in. A third thing you can do if the testing isn't feasible and the quarantine isn't feasible, is that if they are somebody that's been out and about, especially if they're going places where they may have been exposed, that they're not the primary caregivers of you in your room, that you keep a certain amount of distance between them and you. They can be in your household. Remember, we're not so much worried about the air that's circulating. There's still a lot of discussion about that, but by far, people contract this infection by direct respiratory, person-to-person contact. If you clean your surfaces and wash your hands, if somebody is shedding this virus and lives on the other side of your home or in your basement or in the other, you're going to be okay. You're going to be okay with this. So just kind of kind of think about the possibility of everybody being infected. How can you protect yourself in that way? And then if you have the ability to have them quarantined first or tested first, that would be an added level of safety.
All right, closing comments?
Closing comments. You go first.
So we've talked a lot today about schools. We kind of focused a lot on schools and what this looked like, what it's going to look like moving forward. Obviously, this was a trying week for a lot of people in a lot of different areas of the community. And I can appreciate and I feel for all of you in all of your positions. None of this was easy. But I think everybody did as good a job as possible getting through it, and it's Thursday, and you've made it through it. So we're going to see this a lot. We're going to have positive cases in all of our school districts. We know that. We're going to have positive cases in other areas of the community. We know that. And we just have to learn how to get a little more comfortable with that and manage the situation. Just know that it's a situation that we're managing and move forward with life a little bit. And that's kind of how we're going to deal with this.
Yeah.
So thank you all, and Doc, to you.
You know, I'll just mimic that. We learn more from our mistakes than our successes, and we've learned a lot from this. We can do a better. And our staff at the health department is very, very busy doing the work of case investigations, and so. I can't really rely necessarily on that information getting correct without working closely with our school districts, working closely with all of you, and so we're gonna do a better job with that. And thank you for asking the questions. Thank you for putting us on the spot and saying, hey, what does this mean? Because what it's done is taught us where we've not done a good job with that communication. So thank you for that. We've got big shoulders. We're tough. Right. We can take the criticism, but please understand that we're doing the best we can. We're gonna continue to improve, and nothing is ever done with the understanding that we don't care what the results of that decision are. We understand that every decision has a risk-benefit kind of thing, and we take that very seriously. So thank you. We'll see you next week, and keep those questions coming in.
Thank you.
Bye.